One critical decision most pregnant women face during childbirth is the choice of delivery method. Now, currently, we know of two most common delivery methods, which are the vaginal delivery and the Caesarean section delivery, commonly known as C-section. Now, looking at the increased level of pregnant women choosing the C-section method because it is believed it is less painful, many of these pregnant women also struggle as to which of these methods to choose. My name is Isabella Tete Ahinakwa, and you're welcome to Meet the Practitioners on HealthAfrik. This program is brought to you by the Association of African Universities, AAU, and the Center for Pregnancy and Childbirth Education, CPACE. Today's episode will be discussing the two most common childbirth delivery methods, which are the vaginal and the Caesarean section, which I mentioned earlier. We'll go for a quick break. When we come back, I'll introduce our guests to you and then start with the discussions. Please stay tuned. You're welcome back from the break. If you just joined, this is Meet the Practitioners on HealthAfrik. You can follow the discussion on our social media handles at Association of African Universities on Facebook and YouTube. Now, before we went for break, I was saying that today we'll be discussing the two most common delivery methods in childbirth, and these are the vaginal and the Caesarean section delivery methods. Now, we'll be looking at some of the medical indications as well as explore the potential risk and benefits associated to each of them. We are also going to address some of the misconceptions surrounding them. Our guest for today, in fact, he has been with us on this program, and I'm happy to have him here with us to share his insight with us. Joining us is Dr. Sedhalsen Gashon, an obstetrician and also a gynecologist at the Kolebu Teaching Hospital here in Accra, Ghana. Hello, Doc.
Hello.
You're welcome back to Meet the Practitioners.
Thank you very much.
And it's really nice having you here again.
Yeah, I'm happy to be here too.
Great. Yeah. So today we are talking about vaginal delivery as well as the Caesarean section, which is commonly known as the C-section. When you ask someone about these two, the person is obviously going to say one is the natural way to bring out a baby, and then the other one is what the doctors normally do to support childbirth when it comes to emergency or there's a problem. Now, before we delve deeper into today's topic, I would like you to briefly tell us the primary differences between these two methods.
Okay, thank you very much. I think you've mentioned the primary differences already, but I would go a little more into it. So when we talk about vaginal delivery, it's the natural delivery method where the baby passes through the birth canal and is delivered. Whilst when it comes to Caesarean section, that is delivery where the baby is delivered abdominally through an abdominal incision and then an incision on the uterus, and then the baby is delivered. So that's the main difference between the two. Usually for vaginal delivery, recovery time, hospital stay is much shorter than when it comes to Caesarean section. The recovery time is a little longer, and then the hospital stay is also a little longer. And then also Caesarean section may be associated with some surgical risk.
Okay. So Doc, with this said, like I said earlier, currently most of our pregnant women prefer to go for the C-section method compared to the natural one because they believe that is less painful. Now, I would like to know when exactly is a C-section generally considered necessary also or recommended for pregnant women?
Okay. So as I mentioned, the vaginal delivery is the natural method of delivery. If there are no contraindications or if there are no indication preventing it, that should be the way to go. But sometimes Caesarean section becomes necessary because of certain conditions of the fetus and the mother. So usually one of these conditions is when there is fetal distress. So if the baby is distressed, that is the baby's breathing and oxygen use, there's a problem with it because of the delivery process.
Okay.
We may do a cesarean section for the woman. Then also, if there has been a previous cesarean section, that also is an indication for a C-section. Depending on the number of cesarean sections that are performed, it may be an absolute or a relative indication.
Okay.
Then also, depending on how the baby is coming, the baby may be coming with a breech, that is the buttocks. And if that is the way the baby is coming, depending on a few other factors, we may have to do a cesarean section. Sometimes there may be other malpresentations and then abnormal lies of the baby. The baby may be lying transverse, or the baby may be lying oblique, or the baby may be coming with other parts of the body, other than the head, which would warrant a cesarean section. Then also, sometimes if there's a condition we call antepartum hemorrhage, where you may have the woman bleeding before delivery, or conditions that can predispose the woman to bleeding before time of delivery. And one of them is placenta previa, where the placenta comes before the baby. So the placenta is at the lower part of the uterus. So usually when the woman goes into labor, the head is supposed to come first, and the baby is supposed to come first, and then the placenta follows. But this time around, because the placenta comes before the baby, the placenta comes first, and this can cause a lot of bleeding, and baby's life can be lost. So usually in such situations, we do a cesarean section. Then also, there's also another type of antepartum hemorrhage where the placenta separates from the uterus earlier than usual. Okay. And when that happens, we have to do a cesarean section. Then also, certain maternal conditions can also predispose the woman to having the cesarean section. Women with hypertension, severe form of hypertension, diabetes, and then sickle cell disease and all that. These are not absolute indications. Sometimes you may have to consider the severity, and then they coexisting with other indications. There are a number of others. Sometimes when you have twin gestations, triplet gestations and all that, that can put the woman at risk of having a cesarean section. And as I mentioned earlier, with cesarean section, you can have absolute and then relative indications. For instance, if somebody has had 2 previous cesarean sections, it's an absolute indication for CS. Yes, so the woman, even though she can be counseled and all that, a choice of going for vaginal delivery can be detrimental to her health. There are other situations where the choice is a little open. She can decide to opt out or opt in. Okay. So that is what I want to say.
So these are some of the conditions in which a doctor will recommend the C-section for a pregnant woman. Now, I would want to know, how do the medical professionals, determine the most appropriate method for delivery?
Okay. So in determining the most appropriate method, first of all, we look at the fetal condition. So we assess the baby, whether the baby is distressed, the number of babies that we are dealing with, the position, the lie of the baby, and all that is considered. Then also, we also consider the mother. So we want to know the health of the mother, whether her health is at risk if she continues with the pregnancy, or if she delivers vaginally. So conditions like hypertension, diabetes, sickle cell can put the woman at risk, among others. Then also, we also look at the labor process. Sometimes the woman would have gone into a spontaneous labor, and the labor is progressing and gets to a point where it's no longer progressing. We call it failure to progress, or slow progress, or prolonged labor. In such situations, we may opt to do a cesarean section for the woman. Then also, sometimes labor may progress to the point of delivery, and then baby is not coming. We call it obstructed labor. Maybe the size of the pelvis and then the size of the fetal head are not proportionate. So if you push, you may have complications. The mother's health or the baby's health can be affected. So in such situations, we may do a Caesarean section. And then I must mention that sometimes when it comes to Caesarean section, we have an elective and then we have emergency.
Okay.
So an elective Caesarean section is the planned Caesarean section, where we know the reason from the onset.
Okay.
Sometimes even from the beginning of the pregnancy. We know that this woman is going to have Caesarean section. Sometimes to things that may happen during the pregnancy period can determine, and then we will know and plan towards it. That is an elective. Then we also have the emergency Caesarean section, where the woman may go into labor, and then conditions may warrant that we do a Caesarean section, or she may not even be in labor, but a health condition may be worsening, or she may be bleeding, which may require intervention.
Wow. So what's the process of the switch? Does it take long, and will it affect the woman or any of them, the mother and the baby? Switching just like at that moment, that is what you have to do.
Okay. So most of the time, those situations are relatively few. Okay. But when the woman goes into labor, most of the time we counsel during antenatal, as we discussed the last time. We counsel the woman about some of the outcomes and the processes. So when such situations arise, she has already been counseled. She knows that it may either go vaginally or it may go Caesarean. And most of the time, best interest is at heart. So it's based on what is more appropriate for her.
Yeah, that's good to know. Now let's look at the benefits as well as the risk associated to each of them. Let's take the vaginal delivery first. What are some of the benefits and also the risk associated to vaginal delivery?
Okay, so with vaginal delivery, it's the natural method that God created for us. Yes. Most of the time, the woman goes spontaneously into the labor process. It starts slowly and then progresses. As the baby goes through the vaginal canal, the baby lungs is squeezed. So the chest is squeezed. So the fluid, usually the lungs of the baby contains fluid, liquor. That's the fluid in which the baby is. So it squeezes this fluid out. So by the time the baby comes out, most of the fluid is out and the lungs are ready for air. So that's an advantage that vaginal delivery has over Caesarean section. So sometimes with Caesarean section, when the babies are born, they may be breathing fast and all that, because at the time it will take some time for the fluid to come out slowly, which would have happened through vaginal delivery. So that is an advantage for vaginal delivery. And then also for vaginal delivery, there's no incision, there's no cut, the recovery time is faster. The mother is able to bond with the baby fast. At the labor ward, you will see a woman shouting and all that. Then the next minute, she is taking care of her baby. She has delivered. Okay, which may not happen in Caesarean section, because after the Caesarean section, the woman will take some time to recover. She may even be under anesthesia. It will take some time for her to start bonding with the baby. So that's the advantage of vaginal delivery.
Now the risk associated to the vaginal delivery.
Okay, so the risk associated with vaginal delivery is that for vaginal delivery, because it's spontaneous, you don't really plan it. You have to wait. So as a woman, you know your time is up, or you are close to delivery. You don't know when the trumpet will sound. So you are always on the edge. So that's one thing with vaginal delivery. Then also with vaginal delivery, sometimes during the delivery process, there may be a tear in the orifice, that's the vagina, or sometimes if the space is too small, we may cut ourselves, which is called episiotomy. So that is, and sometimes some of these tears can be extensive. Sometimes most of the time, they are not that extensive. Sometimes when they may not even need suturing, but there are times when it can become extensive and may require suturing. And then also sometimes when vaginal delivery is proving difficult and is being pushed. We are trying, maybe depending on where the woman finds herself, maybe a place where she cannot have a cesarean section, or referral is difficult, and they are still trying to get her to deliver vaginally. She can have a number of complications, including fistulas and all that. But those things are very rare these days, especially in urban areas.
Okay, so I'm interested with it here because I do hear many people talk about it and it's painful. You made mention it's not extensive. This is not to scare our audience, but I would like to know the how many inches or centimeters or millimeters do you cut to enable the baby to come? I'm just interested in it. I just want to know
Okay.
to prepare myself.
Okay. So I must mention again that most women deliver without
Without it here.
any cuts
Okay.
or any tear on its own,
Okay.
or even any episiotomy. That's the
Okay.
cut that we do. Most of the time, there's just a small cut to
Hey,
help.
doc.
It may be difficult to tell the length of the cut that is made, but the cut is made in a particular way so that when it extends, it may not extend to tissues that are very important, like the anal sphincter and the rectum. So we try to avoid it going that direction. So, but it can be, once it's done, it's sutured, and the vaginal area, the blood supply is very good. So most of the time it heals very well, to the extent that when you look the next time, it may not, it doesn't show that.
And you don't even feel anything.
You don't
go
feel,
back to your normal.
you don't feel anything. Yes.
Dog.
One is done well.
All right. You may have mentioned some of the risk factors associated with the C-section, but I would like you to mention what are somehow the benefits as well as the risk with regards to the C-section.
Okay, so with regards to the benefits, I think I've mentioned that because most cesarean section, that's the elective type, it is planned.
Yeah.
So the woman knows that maybe on Friday at this time, I'm going to have my cesarean section. So that's when a baby is going to come. The family is all prepared, ready to receive the baby. So that is one advantage of an elective cesarean section. Then also, there are times when vaginal delivery is virtually impossible or can put the woman and the baby at risk. That is when cesarean section comes in. So cesarean section is a solution to a problem. So it's not like it's just done, but it can be a solution to a problem where vaginal delivery may not be possible. And once you do the cesarean section, the woman is able to have a baby, and most of the time she herself is also well. So that's the advantage that you may get from having a cesarean section.
Yeah.
With regards to the risk, because cesarean section comes with a cut, most of the time the recovery period lasts a little longer.
Okay.
And then also the hospital stay may be a little longer. Usually when somebody delivers vaginally, most of the time 12 to 24 hours they are discharged from the hospital. But if you have a cesarean section, following the delivery, you may spend about 3 days.
Okay.
It's about 72 hours in the hospital. Sometimes it may even extend to 5 days, depending on the state of the woman.
Okay.
So that is one of the risk associated with cesarean section.
Okay.
Then also, when you perform cesarean section, because you are doing a surgical procedure, there are complications that can happen. This includes bleeding, infection can occur, there can be injury to surrounding structures and all that, even though a lot of effort is made to prevent some of these things, and especially in good hands, they rarely occur. Then also, because the woman is also put under anesthesia, there can be some anesthetic complications that can occur. But in recent times, these complications have been reduced to the barest minimum.
Yeah, due to advanced research and solutions in our medical sector.
Yes.
I understand.
Yes.
Now, so let's look at some of the misconceptions. When it comes to the health sector, or the health aspect, we have a lot of myths and misconceptions looking at these two delivery methods. For instance, myself, I do hear that, especially during the vaginal delivery, when as the baby is coming, the baby may enter into your thighs or leading to you limping or you not being able to walk after delivery. With regards to the C-section, I've also heard that when you do one C-section, that is all. Throughout your life, if you are pregnant and you're going to give birth, you have to do C-section until forever, forever. What are some of these, or what are the facts behind what I've made mention, and also some of the misconceptions you do hear and the facts surrounding them?
Okay. So some of the misconceptions, I'll start with what you mentioned. So for vaginal delivery, I mean, the baby goes through the birth canal.
Okay.
There's no way the baby will get into your thigh. There's no space there for the baby to get there. You may have pain in your thigh or other parts of your body, but it's not because the baby ended up there. Okay. Then also, when it comes to Caesarean section too, some may believe that once you've had one Caesarean section, automatically all your deliveries are going to be Caesarean section. That is not true. There's vaginal delivery or vaginal birth after Caesarean section. So depending on the indication for in the initial C-section, it may be something that is not recurrent. Okay, so let's say that if the C-section was done because the baby was breech, in the next pregnancy, the baby may not be breech. Okay, but if the Caesarean section was done because the woman had contracted pelvis means that the pelvis is very small, it's not adequate. So that problem may still be there in the next pregnancy, but most of the time the indications are not recurrent.
Okay.
So if there are no other issues, the woman can try vaginal delivery. Some of the things that we consider include things like the weight of the baby. So for instance, if the woman has delivered before by C-section and she wants to try this time around, the weight of the baby is less than 3.5 kilos. We can give her a chance to try vaginally. If she doesn't have any other medical condition like hypertension, diabetes, sickle cell disease, we may allow her to try. If the baby is in a good position, there's no fetal distress and all that, so there's a chance, even though the risk is a little higher compared to somebody who had who had vaginal delivery, the previous delivery. But a lot of people still have normal deliveries after Caesarean section. Once we look at the risk to benefit, because of the reason why sometimes we may have to do it is because of risk of uterine rupture. Okay.
Uterine rupture.
Uterine rupture. So sometimes the uterus can rupture or can break, can open up through either the previous scar or any part of the uterus. So to prevent that, that is why we put in all these measures. But there are some situations where once you've had something like 2 or 3 cesarean sections, you can't come and say that, oh, I want to try the vaginal delivery. It's too late. Because once you've had more than 2 or more, then any attempt to deliver vaginally can lead to complication of uterine rupture. So if it is 1, we have patients who have had their first delivery C-section and they've had 3 after that vaginal delivery. So it is possible to have a vaginal delivery after cesarean section. There are many misconceptions, some cultural, some social.
I was about asking that. I know there are a lot of factors that influence a woman to choose which one. A pregnant woman will come to the hospital. Doctors are saying this is the appropriate method for you, but due to some factors, which I know you may have heard a lot and you share with us, they still insist, this is what I want. So share with us some of these factors.
So some people believe that, I mean, yes, since vaginal delivery is a natural one that God created, everybody should be able to go through vaginal delivery. If you're a woman and you are not able to go through vaginal delivery, it means you are not strong enough you are not active enough, you are weak.
Yeah.
So they may push that the woman tries to have vaginal delivery. Sometimes it's even mothers who can tell the daughter that, look, I had 4 of you, or I delivered myself.
Yeah.
Just one that you are going to deliver, you are going to do Caesarean section. So it's important to note that sometimes there are reasons. I mean, most times there are reasons why we do this Caesarean section. And every pregnancy is different. So you can't compare 2 pregnancies. So there may be reasons in this pregnancy that require Caesarean section. And in fact, for any woman attending antenatal care, going through delivery, our aim is to have a good outcome. And a good outcome means a healthy baby and a healthy mother following the process. So if vaginal delivery will pose a problem that would affect the baby or the mother, then we will prefer to do a Caesarean section. So that is why sometimes C-sections are done. Then also, some also believe that if you are to do Caesarean section, then as you have mentioned all the time, it has to be Caesarean section, which I have demystified in my talk. Some cultures also believe that, as for them, nobody in their tribe should have C-section. I remember I had a patient who, not a Ghanaian, but where she came from, she went into labor and we had to do a C-section for her, and she said over a dead body. Where she comes from, they don't do Caesarean section. Then also sometimes for some places, it's the people who decide whether the woman should have Caesarean section or not are not the woman. It's not the woman herself. It's the husband, elders in the community, family members and all that. They decide that, no, we don't agree that she should have Caesarean section, even if the woman is willing to have the Caesarean section. And because of respect for these people, she may be forced to accept that she was not going to do the Caesarean section. So all these things, sometimes you mentioned earlier that people believe that C-section is the best way, or is more ish in their environment. Yes. In rural areas, it's the opposite, where people believe that, yes, it should be vaginal delivery. But in urban centers, people sometimes associate having vaginal delivery with wealth, having vaginal delivery with having better medical care. So if this woman I respect and all that went to deliver and she had CS, it means that me too, I should have CS. Okay. And then also sometimes people want to have more control over their delivery, over their body. So they may opt that, oh, I want CS. But it's important that we also take note that CS also comes with, even though it may be good, can come with certain risk.
This actually calls for public awareness with regards to the importance of choosing the appropriate delivery method, especially when it is recommended by the doctor. I like where the conversation is going, but then we'll go for a quick break, and when we come back, we are going to look at how the C-section is performed, as well as the recovery times and process. Please don't go anywhere. We'll be right back. Hello Africa is a live breakfast show that aims to give you, our viewers, an informative, entertaining, and energizing start to your day. This isn't just another news show. It takes the form of vibrant magazine packed with news reviews, lifestyle features, engaging interviews, and interactive segments that put you at the center of the action. All you have to do is grab your coffee, get comfortable, and join us for the Hello Africa morning show.
We are here to kickstart your day with the news and stories that matter to you, alongside all the fun and inspiration we crave.
Every morning, join us for
the latest headlines in African higher education, science, and
quick and informative newspaper and online news review.
Lifestyle tips on fitness, nutrition, fashion, and beauty.
Inspiring interviews with influential figures and everyday heroes.
Performances and interactive contests, and so much more.
In Ethiopia, Salam Africa. In North Africa, Alan Afrikia.
In Swahili, Jambo Afrika.
Tune in every Monday from 8 a.m. to 10 o'clock GMT. Join us to make it a fantastic day together. Hello, Africa, your daily connection to the continent.
You're welcome back from the break. If we just joined, this is Meet the Practitioners on HealthAfrik, and today we've been discussing the two most common delivery methods in childbirth, which is the vaginal delivery and the Caesarean section delivery. And we'll be doing this with Dr. Seth Hansen Gashon from Kolebu Teaching Hospital. Before the break, we discussed or we looked at some of the misconceptions surrounding these delivery methods. We also looked at when it's appropriate to consider which of them, and also looked and considered some of the cultural and social factors that influence women as to which of these delivery methods to choose. We are going to continue the conversation. Doc, thank you for sticking with us.
Yeah.
Now, let's look at the C-section or the Caesarean section. How is it performed? If I should come and then you recommend doing the C-section, how is it done?
Okay. So the Caesarean section, before we do the Caesarean section, the woman is counseled. Okay, and then an informed consent is obtained.
Okay.
Once we obtain this informed consent, then we have a time and a date for the C-section. Then the first thing that is done, the woman is prepared, and then anesthesia is given. Usually it's a regional anesthesia that is given, an injection at the back, which will numb from the below the chest all the way down, so that the woman will not feel what is being the process and will not have pain during the surgery. Sometimes too, we do general anesthesia, especially in emergency situations, like when you have fetal distress. We may do a general anesthesia for the woman. So after the general anesthesia, the woman is cleaned, and then an incision is made on the abdomen, just around the bikini line.
Okay.
So once that incision is made, we call it a finastial incision because it's a transverse incision on the abdomen. Then once it's done, you go down to get to the uterus. Then an incision is also made on the uterus. Once the incision is made, now the baby will be delivered, either by the breech or by the head, depending on the position of the baby. When the baby is delivered, then the umbilical cord is clamped, cut, and then the baby is given to the midwife who is there to receive the baby. And then she will take the baby, resuscitate the baby, clean the baby, make sure the baby is breathing well and all that. Then we continue with the surgery, where we now deliver the placenta. After we deliver the placenta, we close the uterus. And then after that, we put the uterus back into the abdomen, and then we close the layers of the abdomen. Usually with the uterus, we use absorbable sutures, so you don't need to go and remove the sutures. And then all the way to the skin, most of the time we use absorbable sutures. A few times for the skin, non-absorbable sutures may be used, which can be removed later on. But most of the time these days is absorbable sutures that we use throughout.
The ones that dissolve?
They dissolve
by
by themselves.
And
this process can take about 30 minutes to an hour.
Okay. It's not that long.
It's not that long.
Now, in your submissions, you made mention of some of the pain management the anesthesia gives to reduce the pain. When it comes to the vaginal delivery, which is a natural way, do you have some management, especially with the pains, to at least help mothers reduce the pain of labor and delivery?
Okay, that's a good question. So the fear of pain is one of the challenges with vaginal delivery, where women are so scared that, they will go through pain, and not for 30 minutes, but sometimes even for a whole 24 hours, she's going to be in pain. So there are various forms of analgesics, as in painkillers, that can be given during the labor process. Sometimes there are injections that we give. There are inhalation drugs that are also given, which is not very common here, but we give the injections which can help bring down the pain. And then there's also what we call epidural. With epidural, an injection is given at the back, and then a tube is passed into the spine area. And then top-ups of analgesics will be given from time to time. And women who have this epidural can go through labor and delivery almost painless. So that can also help for those who are going through vaginal delivery.
Right. And also, when we were talking about the differences between these two delivery methods, you made mention that especially the recovery time, the vaginal delivery is quite shorter compared to the C-section. I'm interested in the process. If I'm to deliver via the natural way, what are the process for me to recover early? And when it comes to the C-sections, so after that, what are the process I have to go through to help me recover early?
Okay, so in an uncomplicated vaginal delivery, once you deliver, most of the time the women are okay following delivery. They may have some after pains because the uterus is now contracting and then trying to go down to its original size. Sometimes during breastfeeding, they may feel some pain down there, and it's because of the oxytocin that is released during the process. In fact, it's very important because it helps the uterus to return to its normal size, which usually occurs around 6 weeks of delivery. So, so for these people, there's not much they can do. Usually after the delivery, there will be lochia that may be coming and all that. Most of the time, we don't put them on antibiotics. Okay, because I mean, once there's no cut. But for those who end up having a cut, or either the one that may have occurred by itself, that's a tear, or an episiotomy, we tend to put them on some antibiotics. And then they may need to care for that episiotomy because sometimes it can get infected. So usually we advise them that they can wash the place with Savlon, dilute Savlon, just to wash the place. They shouldn't sit in water or sit on hot water. Because sometimes when you do that, it will rather loosen up the stitches, and then what has been sutured nicely will now gape. So we advise women not to sit in water. It's one of the things that when they go home, they get different teaching from the house. So that is for vaginal delivery. For Caesarean section, in fact, for the vaginal delivery too, we put them on painkillers, which also helps with the pain. For Caesarean section, because there's an incision on the uterus, most of the time, the initial one may heal within a few days.
But the
inner one will take time, so they may still be having some kind of pain, but we put them on analgesics to help, so the pain is not too unbearable. Then also, the skin incision is very, very important, because if it doesn't heal well, infection can pass through to the inner organs or tissues. So we usually cover it within the first 3 days. And then when it's exposed, most of the time it may have healed or it may have closed to some extent. But strenuous activity, active movement can disrupt it. So we usually advise the women against those activities. And then also, sometimes it's important to also take care of it. Sometimes there are times that we may advise women to hold on with bathing their body with a lot of water and all that, depending on how we see the wound to be. And then also they need to be observing the wound for possible discharge, or maybe if some part is gaped or something. Sometimes women may notice something like that and they may stay at home for a long time, because they will say that, oh, it's not yet time for my review. By the time they come, it would have gotten infected. Usually, I said that a stitch in time saves 9. So if they come earlier, we are able to handle it and then prevent it from escalating. Sometimes just putting them on antibiotic will shorten the whole process.
So as you were talking, you do mention some of the health implications, especially the short term. Is it possible? Are there any long-term health implications when it comes to the C-section delivery method?
Okay, so for both of them, there are long-term complications that can happen. So, for instance, for those who have vaginal delivery, especially those who have had multiple births or deliveries that are very difficult, they can have injury to or weakness of the pelvic floor. And once they have that, sometimes they can have prolapse later on in later years, where the pelvic floor, which is supporting the uterus may be protruding slowly and may even come out.
Oh, really?
It's not very common, but it can happen.
Wow.
Then also, sometimes some may also develop incontinence, where they may not be able to control urine or feces, fecal passage. But it's also very rare. But for people who have had multiple childbirth or very difficult deliveries, this can occur. So it's important that women look out for those things. And once you identify it, it's important that you see your doctor. One of the ways you can prevent this is to do pelvic floor exercises. We call them Kegel exercises.
Is it the one you squeeze?
Yes. So you, as if maybe when you are in a place and you have to urinate, and you feel like you have the urge to urinate and you don't have access, so you try to hold it. So what you do that and then release. Release, you squeeze and release. And then also you can squeeze, hold for a long time and then release. This is an exercise that you can do anywhere you are. Nobody knows you are doing it.
As I'm sitting, if I'm doing it or not, you don't
know. Yeah, so it's very good because it helps strengthen the pelvic floor. In fact, it also helps with tightness and rejuvenation of the organ following delivery. So that can be done. For Caesarean section, long-term complications that can occur may because of the cut. For most people, once it is healed, that is all. They don't feel pain. But a few people may still have some chronic pain following the Caesarean section. And then for some people too, they may develop adhesions. So adhesions means that the organs in the body have attached to themselves because there have been raw areas and all that. They can attach to themselves. So if you are going to do another surgery for the person, it may be a little more difficult and you need to take that into consideration. And as we mentioned earlier, if you've had previous Caesarean sections 2 or more, it's very likely that your subsequent deliveries may have to be CS. Sometimes, we advise that women don't have more than 3 Caesarean sections. It doesn't mean that Caesarean section is limited to only 3. I've had patients who have done 6 or even more Caesarean sections. It can be done if it is warranted, but you always have to look at the risk to benefit. So if you've had enough children, you've had a number of children and all of them have been Caesarean section, each Caesarean section is a little more complicated than the previous one. So if you've had 6, that means that it's also the 6th one will be more complicated than the previous one. So the more you have, the more you put yourself at risk. So usually we advise 3, but there are situations where 3 may not be enough. Maybe the woman may have delivered, has lost some of the children or has issues, so may still want to go further. Once your doctor who did the surgery for you advises that, oh, the way is clear, you can go, there's no issue.
Right. Thank you very much, Dr. Garson, for sharing your insights, your knowledge and expertise with us. Before we wrap up, I would like, I know someone watching us is still scared and still in fear of giving birth and even getting pregnant, what will be your final words or your advice to women, especially those who require the C-section?
Okay, so my advice is that women should, once you get pregnant, you have to deliver.
Yeah.
And the focus should be on the outcome and not necessarily the process. Because you may decide to, or you may think that, oh, as for me, I'm going to have vaginal delivery. But along the line, things may change and you may need a Caesarean section. So you should be ready and prepared for both, whichever one is best for you, according to your doctor, based on a thorough assessment of your situation, yourself, and then the baby. So be open-minded and then read around, stay educated. Anything that you see or programs like this, sometimes when people see a program like this, they will change to telenovela and then be watching those ones. But it's important that you listen and read things related to your condition, which can help you. And it will even inform you when you go to your doctor. You can be able to ask relevant questions. And then also, it's important that you trust the doctor that is taking care of you. If you don't trust the doctor, then it's better you change to another doctor. But once you've decided that this is the doctor that is seeing me, you trust the doctor. But that doesn't mean you shouldn't ask questions. It's important that you ask questions as you go along. Questions on why Caesarean section, how, when,
what's next,
and all that. So once you are asking those questions, the doctor will also try as much as possible to address your issues, and all this will allay your fears. And I always tell my patient that as long as you see people who have delivered either vaginally or Caesarean section and they've gone through it, you can also go through it, no matter how difficult it may seem initially.
Right. Thank you so much for joining us today, and we hope and we believe that you come back to us and share more insight with us on childbirth as well as pregnancy. That will be all for this episode, and as Doc made mention, you should always focus on the outcome, the beautiful baby you'll be bringing out to the world. Focus on that and not the process, and always trust your doctors. Listen to them. My name is Isabella Tetahinakwa. If you just joined, today we discussed the two common delivery methods in childbirth, which are the vaginal delivery and the Caesarean section, commonly known as C-section. You can go to our social media handles, Association of African Universities on Facebook and YouTube, to follow the full discussions. Catch you again in our next episode. Bye.